In March of 2020, the world as we knew it changed. We paused in our homes and listened to Governor Cuomo and watched as long lines of people who thought they were sick with COVID-19 lined up to be tested and admitted to hospitals.
People stayed home, they took it seriously, they really made the hard decision to stop their work.
There was just so much unknown about what the disease was and implications of how severe it would be. It felt like every day was a new story was coming out.
And now that it's warming up again, I know people are really anxious to get out and start experiencing summer. I just want to make sure people realize that this is not the time to become complacent. We've seen lots and lots of data to show that it's not over. We're seeing some increasing cases in places where people are not taking seriously the social distancing, and seeing outbreaks in communities where people are exposing themselves in either, social settings of just parties or just getting out there because they're not worried.
The COVID was unlike any asthma I had ever experienced. I was so short of breath, I was unable to talk to anyone for weeks. I slept my days away when I wasn't spending them in the bathroom. After 9 weeks, my breathing is back to where it was when my COVID started, half of what it should be.
I experienced symptoms of COVID-19 back in March. I ended up going to the emergency room. I was afraid that I ended up going to the hospital and not able to see my family again. That was my most worst fear.
I had COVID. I was out of work for 3 weeks. I was in the hospital for 4 days. I was so short of breath. My oxygenation was only 79%. Wow. When I went to the emergency room, the doctors did not send me home. So thank God I survived. Yeah. After that, I came back to work. Yeah. It was so good to see my colleagues again. Came back and take care of COVID patients again.
I have a son who has physical disabilities, and he turned out positive for COVID. It really is anxiety provoking. He has to stay indoors all the time now. We're quarantining.
This virus can affect all age groups. In the emergency room, I saw a wide variety of patients in their 20s, from in their 90s, who were extremely sick, various symptoms, and it can happen to anyone.
We did see a lot of really sick people present at a very young age, and were shocked at some of the impact that the disease had.
I've seen more people seriously ill to the point of dying in the past 3 months than I've seen in my entire 20 years of previous training.
Through this COVID period and pandemic, it has been very difficult for our patients. I lost about 10 patients, and it's very difficult in the office with patients being so ill and being so, for us and the whole staff, being scared of what was going on.
I saw a lot of COVID cases. Most on the floors ended up doing better, but the ICU cases were a lot tougher. It was hard to get those patients off the ventilators, unfortunately.
Just the overall tone was a lot of death and despair. A lot of the patients did not do well. They didn't have good outcomes. And it felt like anytime we had a little success, it feels like a miracle.
I was very scared about COVID. It's very emotional, especially you try to do your best, and the next day you come in and somebody passed away.
I finally just saw my parents for the first time in the 3 months last week, and just because it was my dad's 80th birthday. And I took him for a walk around the block, and we were all wearing masks and standing 6 feet apart. But it was really upsetting because people came near us, younger people who weren't wearing masks, and I was so worried about my dad. I'm worried about the health of the people that I love, and I wish that people would just show the same kind of respect because, we have to do that. It's a community.
I would ask everybody to follow all required rules to stop the spread of the virus. Social distancing, washing hands, wearing masks, and most importantly, to be mindful of everything you're doing.
If anybody has any symptoms, it's important to get tested right away. Now we're at a very important juncture. People are getting excited to go out more and interact more with other people. And as cases are going down, we're still unsure exactly what's going to happen going forward. Is there going to be a second outbreak? Is there going to be people having reinfection? How long is this pandemic going to stay with us for? So I think it's important going forward to listen to the guidelines that are being set out, trying to social distance as much as you can, the importance of continuing to wash your hands and wear a mask as much as you can.